Away from that, the Ministry of Health, together with the Ministry of Education and Sports, have appealed to the general public to remain calm following the outbreak of Influenza A virus in schools, as the country remains on a high alert to prevent any potential insurgency of COVID-19. We have the details.
While addressing journalists at the Government Media Center in Kampala, State Minister for Primary Education, Dr. Joyce Kaduchu, said samples taken from 128 out of the 431 who presented symptoms that were thought to be COVID-19 all tested negative for coronavirus, whereas 58 samples tested positive for Influenza A, while 2 tested positive for Influenza B. Kaduchu said there were no symptoms of COVID-19, like loss of smell and respiratory failure. This therefore confirms an outbreak of Influenza A in congregate settings.
This therefore confirmed an outbreak of Influenza A in this setting, which we think is across the country. The co-circulation of Influenza A and B is not a unique finding in these congregated settings. The Ministry of Health, together with the Ministry of Education and Sports, have continued to work together to investigate and to respond to other clusters of upper respiratory tract infections in schools to ensure there is no potential misdiagnosis of COVID-19 in these schools.
It should be noted that younger learners appear to have a higher attack rate as compared to older learners. The minister, however, urged the general public to remain calm and be vigilant in the wake of the outbreak of Influenza A, as the country remains on high alert to avert any resurgency of COVID-19.
I'd like to reassure the public to remain calm and vigilant in the wake of this outbreak of Influenza A, as the country remains on high alert to avert any potential resurgence of COVID-19.
Ismail Mulindwa, the Director of Basic Education in the Ministry of Education and Sports, has guided that schools scale down on activities that would gather all learners in order to manage overcrowding, among other guidelines.
I've seen some schools which have become very innovative in the way that they are even using shades to conduct classes. So those kind of innovations are encouraged so that schools can also manage the overcrowding. But the magic here, and I think the medical people should have talked about this one, is that we need to emphasize the putting on of the mask.
Influenza is a viral infection that attacks the respiratory system, including the nose, throat, and lungs. People at higher risk of being affected by influenza include young children under the age of 5, adults older than age 65, residents of nursing homes and other long-term care facilities, among others. School administrators are urged to ensure that learners are well hydrated if they are to manage this virus in schools. Nalugo Muyingo, Africa Today.